afternoon, New Day broadcast audience. I am here with Wells Kilgore, the Chief Operating Officer of Morningstar Children and Family Services. It's such a pleasure to sit with Mr. Kilgore. I've been working with Mr. Kilgore since 2007, and it's been a distinct pleasure. And I just wanted to get a little information from him about what he does to prevent child abuse and bring awareness to this incident. Wells, thank you for having me here and agreeing to this interview. It's such a pleasure to sit here and talk to you. And I just want you to tell our audience a little bit about just your career. How did you get started with working in child welfare and in this area of your career?
Well, I was still in college. I lived upstairs over near Emory University from two chaplains who worked in mental hospitals.
Okay.
And to tell you the truth, they had a Thursday night poker game. And I used to go down and play poker with them when I had enough quarters to scrape up.
Okay.
And one of them asked me if I'd like to go out to the state mental hospital and make rounds with him at night after hours. And we made our way around the whole hospital. It was really a big place. So we went to 5 adult mental health units. We went to the alcohol and drug treatment unit. And the last stop was the child and adolescent unit. And I was fascinated with the kids and talking to the staff about them and how they had ended up there and what their stories were. And of course the kids were all excited to see a young, very young at that time, stranger who probably looked like a Vista worker, they told me, from their neighborhoods.
Okay.
And so when I was done with my studies and still friends with all the chaplains, one of them told me, why didn't I come out to the personnel department?
Okay.
And I did. And they talked to me about, at that time, being put on what was called a career ladder. So if I would come in at the lowest level, then if things worked out after I was trained, that I would be promoted. And they started me out with older adolescents and some adults, and did that for about a year, and an opportunity came up on the adolescent unit, and I was hired and placed in what they called the social work technician position, which was a bachelor's level case manager kind of job. And we wrote a few grants. I got bumped up a little bit from that, and I stayed with them for 11 years.
Wow. It was that Hillside?
No, that was Georgia Regional Hospital.
Wow. Oh, it was right here.
No, it was in Atlanta.
Atlanta, okay.
The big one.
Okay.
And then, well, to explain a little bit, children who needed long-term care, longer than those kinds of state hospitals could give, DFACS kids, were placed out of state. Around that time, we had about 90 children from Georgia around the country, spread out. And they wanted to bring the kids back home. And they knew that part of my job for the state had been visiting those kids in those facilities, seeing if they were treated well, reviewing their case files, auditing their records, that kind of thing. And so it was kind of set up through the state that I was hired in the private sector by Hillside in Atlanta to be the program director. And we were committed there to bringing kids back who were out of state. You gotta understand that a lot of those kids, they were abused, neglected, abandoned type kids to begin with. Then they got in the system, then they got sent out of state, and the only people that came to visit them was twice a year. Somebody like me, who maybe they didn't even know, would come visit, ask them how they were doing. But most of them, their families were not able to make it all the way to Miami or to Texas or wherever. So that was my job at Hillside, and a lot of people didn't like that because they didn't want the more difficult kids. They didn't want lower IQ kids, so that was a bit of a tough break-in for me.
Speaking of the challenging children that we work with, did you ever find it, especially being so young at the time, did you ever find it intimidating to work with that crowd or that population of children?
Sometimes. You know, at the state hospital, they were going to close the pool because they didn't have any lifeguards. This is just a little story. And so 5 of us went and got trained as lifeguards and came back and said, can't close the pool now.
Right.
So I'm lifeguarding at the pool, and I'm just they didn't have a lifeguard stand at that time. I was just sitting in a chair on the ground. And I got hit as hard as I've ever been hit in my life in the back of the head.
Wow.
A kid named Bobby just clobbered me, knocked me out. Matter of fact, my now wife was working there then, and one of the kids ran across the street. She was a teacher. One of the kids ran across the street to tell her Bobby had killed me.
Oh no.
And, you know, so sometimes it was intimidating, but most of the time, I mean, I really liked the kids. And it's fun work. A lot of these kids were seriously in crisis when we would get them.
Right.
And a lot of them were psychotic. So they were coming off the streets unmedicated. And those were the ones that were the most unpredictable. But in general, no, I haven't been intimidated a lot.
And how did you stay passionate over so many years? I mean, you have a long career in this for advocating for children and ensuring that they would be in the safest place.
I think I'm one of those lucky people that didn't burn out.
Very lucky.
I can't tell you why. I'd like to tell you I'm tough or I'm this or that, but I think probably luck plays in it. I think I was probably chosen to be in this field in a way, and I've always really enjoyed it. So it's been fun for me.
Well, that's good. We need people out here that have that kind of passion. I think that's a challenge for a lot of professionals, that even though they care about the children that we serve and the families that we serve, there is an area where you do get burned out from the work because it's very challenging. And if you're not burned out, how do you keep yourself from being desensitized? Because I know you've probably heard every situation, every scenario that could happen to a child.
You would think.
Okay.
But
so
up
you
here,
still get surprised?
you know, we read referrals every day, and the world is, in many ways, a much more bizarre and strange place than it was when I started doing all this. We, in the early 70s, we were looking at parents who probably drank and drugged, but would never tell us they did it during pregnancy. Now in the Dr. Phil age, people are completely open. You know, we know a lot more about the sexual abuse kids go through now, because people are much more comfortable talking about sex. Back in the early 70s, the kid who was sexually abused was very likely never to talk about it.
I believe that.
And now I think they see talk shows, they see documentaries on TV, there's education in school. So they're a little more open and able to talk about what's happened to them. And that's, you know, as we read those histories, we just stop every once in a while, Janet and I, or Vernon, these are other folks on the admissions team. And we have to take a deep breath because we're all about to say the same thing at once, and that's, oh my God.
Right. Overwhelming.
Yeah. Yeah.
Right. So I guess you can't get desensitized to it. It always has it. How do you deal with the heavy emotions? I've worked since 1998. My career is not as long as yours, but I found myself getting in the car and just crying after meeting with a family or meeting with a child. Or I found myself even reading the case file when no one was there. I can't even place a face to the words, but still crying over the horrific stuff I just been exposed to. So how do you, keep yourself going and not bring those emotions that come in with working with these families?
I think we're probably all defended in some ways. I tend to intellectualize it, maybe read books about it, get on the internet. These days, we have the internet today, we're able to, it's not, you don't have to go to a library to read all the articles. And, of course, one of your questions is this the only child this has happened to? And the answer is no. The answer is if it happens in Brunswick, it's very likely to have happened in Los Angeles, in Seattle, Topeka, Kansas, Chicago, anywhere. That we're not looking at just isolated cases. We're looking at sort of a epidemic. That might not be the right word. Right now everybody's talking about an opioid epidemic. It's really ironic to me because I know, this has been going on for years.
Yes.
This didn't happen overnight. We've been seeing parents hooked on this stuff. We know the stories. We know what's been happening. What's happening now is people are dying at an alarming rate because they've been doing it so long. They're overdosing. They're using heroin when they're running out of opioid pills. But a lot of, the public's view of a lot of what we do is really stilted.
Right. They can never imagine.
The public probably doesn't know, although it's in the paper frequently, that there are 15,000 mentally ill people at least on the streets of Atlanta.
Wow.
And they're here in Brunswick because they have nowhere to go. And that's at this stage of my career, one of the things that worries me the most is, will these mentally ill kids with these terribly horrible life experiences, when they become legally an adult, will they live under a bridge?
Right. And there's statistics that suggest that they don't have really positive outcomes. Even with the great work that we do here at Morningstar, their chances are.
We can do it for them when they're a child. We can try to fix them so they don't end up in that situation. But it's a trap when they become older because psychiatric hospitalizations for adults are probably averaging 72 hours. There isn't time to do much of anything. There isn't the support, the caring. What we do in this field, and you know this, is a lot of what we do is supported by government funds, but that's never enough. We get charitable funds because people are willing to help children.
Right.
But when it comes to adults,
Unfortunately.
there's not as much giving. There's not as much support.
Right.
There are no programs like Morningstar Residential for adults that I know of, unless you're rich. Sorry to talk about economics, but economics are a large part of what we do.
Yeah. So what has been some of the most challenging areas in your career far? Like, is it whether the children or the people or the bureaucracy? What have you found to be most challenging?
Well, the bureaucracy can be very challenging. The very government that says they need programs desperately then over-regulates an industry beyond
Oh my goodness, yes, I can attest to that.
my comprehension. And anything that, the public probably doesn't know this, but anything that we take a child who hits people and runs away. If that child hits somebody or runs away when they're in our custody, we're immediately called to task on why they did that.
Exactly.
They come from a long string of that kind of behavior.
Yeah.
They come in and do it, and is it that we're not properly staffed? Were we not paying attention? Did we do something to the child to make them hit somebody? That's challenging to me.
Yeah, very.
And the finances are, as you know, challenging. I mean, a lot of what I do right now is just try to keep our organization stable, payroll paid, insurance coverage good and paid for. At the end of the day, there's not much left over for us, if anything. But we have tried for the last 6 years here to provide the services, carry out our mission, and do so in a financially responsible way.
Okay.
That's hard.
Right, exactly.
That's challenging.
Yeah, it's like a juggling act. And what has been your most rewarding? I mean, I know you probably had so many rewarding moments in your career, but if you could just sum it up, what's been most rewarding for you?
Last November, went to a conference in in Augusta. And I had a guy come see me. I still want to call him a kid, but I had him when he was 16 in 1985.
Wow.
And now he's a shift supervisor in a plant in Augusta.
Wow.
He's had the same job about 15 years.
Wow.
Owns a house. Met his daughter. She came to dinner. And you know, he remembered everything I think I ever said to him.
Wow.
So that was probably the most rewarding, to see
That's
somebody
awesome.
who really got out there and made it.
Right. Because even though we know their success stories, it's very rare that we get to see it like come fully manifested, I guess is the word I want to say. So that, I guess that would be pretty rewarding. Kind of makes it all matter.
Like
Makes
everyone
sense.
else, he's had a divorce, he's had some bumps, but he's had a good life.
Yeah.
You know, and we were able to intervene with him at a time where, as he said, he could have seen himself in jail or institutionalized, and he's had a good life.
Okay, awesome. Now we talked a little bit about what you've done over your career in the past. So where are you now with Morningstar? And tell us a little bit about Morningstar. I know about Morningstar, but I want our audience to know a little bit about what Morningstar does in this community.
Well, Angel provides foster care services and foster
Yes, I do.
homes. And Angel, as she said, we've been working together for years, and she came to us, a lot of experience and a lot of background in this field. We have a residential program on 363 acres of
Wow,
land
I didn't know it was that many acres. I didn't know that.
on the north end of the county here, that was at one time home to Native Americans, at one time a colonial plantation, at one time a state park. And right after World War II in 1946, the property was turned over to a man that had a vision of starting a boys' town in Georgia. They called it Boys Estate. It later added girls and became Youth Estate. And I guess in the mid-90s it was acquired by Morningstar. And I was really excited to leave Atlanta and come here, and I had no idea the extent of all the work that needed. Half the buildings that are open today were not open then, they were closed buildings. We didn't have a cafeteria, we didn't have a gym, we didn't have any place for any indoor recreation, even a covered pavilion. So we have made a lot of progress.
Oh yeah,
but
most definitely. Even in the time I've been here, I've seen the progress.
we have a long way to go. We have an accredited school on the grounds. It's a cooperative agreement between Glenn County and Morningstar that works very well. We do mental health services for kids in the community here. And we're hoping to expand that program more into Brunswick. Make it more accessible to our kids and their families.
Okay.
So those are some goals for the future. And we hope, I've been visiting independent living programs around the state.
Okay.
These are residential, and I've got a couple of buildings I'd really like to turn into a independent living program.
Wow. Much needed too.
This would be to bridge the gap. Many of our kids leave places like ours and they don't have all the skills they need to make it in the community. So we're excited about that.
Right. That sounds really good. It really does. Well, awesome.
That's the future.
Yeah, awesome. And so if someone wants to get more information or partner with Morningstar, because April is Child Abuse Awareness and Prevention Month, and that's one of the reasons why I wanted to speak with Mr. Kilgore about the great work that Morningstar does. And I know he is a child advocate, whether it's here in his role as CEO, and I know he'll go out there and talk with children and interact with the children, so it's not just an office thing, he's an advocate to his heart. How could someone partner with Morningstar? What does Morningstar need from the community, and what does Morningstar add to the community?
Well, we need all kinds of resources, everything from building materials up to and including money.
Okay.
Volunteer work. Right now, I need a couple of painters. We've got some classrooms and some new offices that need to be painted and fixed up before we occupy them. We had a fire 12 years ago, and Angel knows all about this, but it burned my office and my office building to the ground. So a lot of us have moved. I think I'm in the 4th place I've been since the fire.
Right.
And a lot of us don't have a permanent place yet. So that's why we're painting right now, is we're trying to get a couple of rooms ready so that they can be offices. For Gary, for the training department.
Awesome. Yeah, that's great.
Because right now, he just sits out in the open in this room that he can't close the door, he can't do. He's really limited
And
with
with all
space.
that land, with the assistance of the community, there can be so much more added to the land that Morningstar
Oh,
has. Yeah, definitely.
Yeah.
Yeah. Or kind of one-stop shop.
So they can call Katie Morse, M-O-R-S-E, at 912-267-7583.
And that's one of the things I ask audience. I ask, okay, if you want to partner with this, you don't have to necessarily be a foster parent, even though I could use foster parents. But there are other ways to partner with programs like Morningstar to help prevent child abuse and make the community more aware of what's happening to children. There are children right under our noses that are experiencing horrific events in their life, and we're a safe place. We're a safe haven for them, and hopefully we can transition them back into the community a little more stable and healthier than when they came in. And I know that Wells is quite a pioneer and quite a advocate in that area. So thank you so much for your time, Mr. Kilgore. I really appreciate the interview. And even though we've worked together for years and we're a lot more formal than we normally are, I really appreciate hearing a little bit from you about the background that led you in this career. So is it what one thing you want to leave with our audience before we finish about child welfare and child abuse prevention and awareness?
Don't forget, this is America. Our kids should be our priority. We were told when we were kids that we were the citizens of the future. And we need to make sure that children in need and in trouble stay our nation's priority.
Well, thank you. Thank you. And like I close every broadcast by saying, with every new day, there still remains hope.